Imagine going in for surgery, lying on the operating table, feeling nervous as bright lights shine down on you. The doctor tells you to take a deep breath, and within moments, the world fades away. Time skips forward, and when you wake up, everything is done. It feels like only a second has passed, but in reality, hours have gone by. How does that happen? What kind of magic allows us to undergo surgery without feeling pain, or even being aware of what's happening? That process is called anesthesia, a well-researched medical technique that ensures patients feel no pain during surgery. Anesthesia is one of the most fascinating and life-changing discoveries in medicine. Before it was invented, surgeries were brutal. Patients had to be held down, biting on leather straps or wooden sticks to endure the pain. But today, anesthesia allows doctors to perform complex operations while patients sleep peacefully, feeling nothing at all. But how does it work? What actually happens in your body when you go under? To understand anesthesia, we first need to know how the brain processes pain and consciousness. The brain is like a giant electrical network with billions of nerve cells communicating through tiny electrical signals. Pain is a warning system. When you get hurt, nerves send messages to the brain telling you something is wrong. Normally, you feel every cut, pinch, or burn. But anesthesia interrupts this system, blocking those signals before they can reach your brain so you don't feel a thing. There are different types of anesthesia, and each works in its own way. Local anesthesia is the simplest. It numbs only a small part of the body, like when a dentist gives you a shot to stop the pain before pulling a tooth. It works by blocking the nerves in that area, preventing them from sending pain signals. You stay awake, but you don't feel pain where the drug was injected. Regional anesthesia goes a step further. It numbs a larger part of the body, such as everything below the waist. This is often used for childbirth, so a mother can stay awake while delivering her baby but not feel pain. It works by stopping nerve signals at the spinal cord so they never reach the brain. General anesthesia is the most powerful. It doesn't just block pain, it makes you completely unconscious. This means you won't feel, hear, or remember anything during surgery. Doctors usually deliver general anesthesia in two ways: through a gas that you breathe in or through an injection in your vein. Once the drug enters your system, it quickly spreads through the blood, reaching the brain. There, it slows down brain activity, almost like flipping a switch to turn off consciousness. Scientists aren't completely sure why general anesthesia works the way it does, but ongoing research suggests it alters how neurons communicate and disrupts consciousness. It's a mystery that researchers are still trying to solve. What they do know is that anesthetics affect the connections between brain cells, reducing their ability to communicate. This makes it impossible for the brain to form memories or process pain. It's as if the brain enters a deep, dreamless sleep, similar to a coma but completely reversible once the anesthesia wears off. While under anesthesia, your body is still very much alive, but your vital functions like breathing and heart rate need to be carefully monitored using advanced machines that track oxygen levels, pulse, and other key signs. That's why anesthesiologists, the doctors who specialize in anesthesia, play such an important role. They adjust the amount of medication you receive, making sure you stay asleep but safe. Too little anesthesia, and you might wake up during surgery. Too much, and it could slow your heart, or breathing too much. Finding the right balance is crucial. Once the surgery is over, the anesthesiologist stops the drugs, and the effects begin to wear off. It takes time for your brain to fully wake up, which is why people often feel groggy, confused, or even emotional when they first regain consciousness. Some patients don't remember anything, while others recall strange dreams. Over time, the body clears out the anesthetic, and you return to normal. Anesthesia has transformed medicine, making surgeries safer and less painful. It allows doctors to perform life-saving procedures that would have been impossible in the past. But despite being used for over 150 years, anesthesia still holds secrets that scientists are working to unlock. The next time you or someone you know needs surgery, you can rest assured that anesthesia will keep you safe, comfortable, and completely unaware of the incredible things happening while you sleep. Advances in medicine continue to refine these techniques, making surgeries even safer than before.
Got a question about how something really works? Drop it in the comments and we might cover your topic in our next video.